In terms of gaining your healthcare experience hours, was
Mhm.
it challenging to find those experiences, and how did you make the most of it once you secured those experiences?
Yeah, so I think healthcare experience is super important, especially for the PA program. Being on the other side of it when I was applying, I was like, okay, this is just something that I need to check off. But as a student now, I can see why it was so important. We really jump into the curriculum so quickly. So having experience with patient interaction, intercollaboration, it's so important. And having that experience is just going to help with the transition into the actual role, but also into your learning as a PA student as well. So I definitely was nervous about finding patient care experience. I didn't know what constituted as patient care experience. I was also so nervous, like, right out of undergrad, how am I going to get a job where, they would allow me to have that type of interaction? Um, what I found was that for a while I was looking through and trying to find these jobs, but honestly, I would say the best way to do it is through your connections as well. Like, talk to people that are in spaces that you're interested in. So for me, that looked like, I went to a physiotherapist and I as my own for my own treatment, and I was like, I'm really interested in this. Like, we built that kind of connection over time, and then having her learn about my interests, she was able to really recommend me to a clinic that she knew that was hiring. So that's kind of how I got started with my physiotherapy receptionist role. um, and then in terms of the occupational therapy assistant role, I found that people get nervous to reach out to people online, but that is my favorite way to build connections. I message people on LinkedIn all the time. I message people on Instagram all the time. The worst thing that can happen is that you don't get an answer or you get a no. And the best thing that can happen is you can get a really awesome experience. And that's what happened for me. So, get over those nerves. It can be tough, but you never know what kind of experience you can get if you just put yourself out there. So that's what I did. I reached out on LinkedIn to an occupational therapy clinic in Milton before I actually moved there. And we kind of were able to talk back and forth and discuss my interests and what I wanted to learn. And then when I got to Milton, I started off as a volunteer actually. So that was a great segue too, is starting off volunteering so that they get to know you, build a relationship with you, you can have more flexible hours. And then when I was able to start working, which was, I think, 1 month or yeah, 1 month before the PA application deadline, that's when I started actually getting more work experience within the OTA role. And because they had already known me, they were able to really give me more autonomy within that role as well. And like, I was able to do a lot more than I would have if they didn't have that previous experience with me. So it can be challenging to get patient care experience, but it's incredibly important. And then I think the second part of your question was how to make the most of those experiences, right? So one thing that I remember really noting down, it was a huge tip in one of the videos that I had watched about previous PA students. They mentioned to keep a journal so that you can reflect on your experience. And I think that is the best tip that I've heard. Every day, I would kind of, at the end of my shift, I would write into my phone the date, the patients that I worked with or the clients that I worked with that day, and what I learned, what I saw, and how that experience can possibly connect to the PA role. And I think that was really helpful because when I went to go write my application and prep for my interviews later on, I already had this toolbox of all of my different like experiences and things I had seen. And so, yeah, I would definitely say be heavy on the reflective aspect. That's really going to help you in the long run for your applications and in your development as a learner too.
It sounds like from these experiences that you were able to obtain pretty strong references as well. So can you tell us a little bit about what that process was like for you?
Yeah, I know like asking for references can be super nerve-wracking. That was something I was nervous about too, because I felt like, you don't want to bother anyone, but also these are people that care about you and your journey, right? So if you've maintained those relationships, they're going to want to see you succeed. So definitely through my occupational therapy assistant role, I built a really great relationship with my manager, and she was the one that I'd work with every single day. So she was able to see me interact with patients, see how I pre-planned sessions, and really work with me one-on-one. So I wanted people that had that kind of input and outlook. So it was nice to have such a close relationship with her. And she wrote one of my references. And then in addition to that, I also wanted to balance my references. So, I had one referee that was based on my patient care experience, and then I wanted one that could talk about my academic strengths as well. So during undergrad, it's really important to build those relationships with your professors. I know it can be challenging, but it really, not only does it benefit your learning experience, but then also post graduation, it's easier to ask for that reference as well. So I had one professor from my disability studies course that we were able to develop a really great relationship with. And I actually am still doing research for her now. So not only did she see me as a student, but also now as an employee. So she was able to talk on both of those aspects. So asking her was a little less scary because we had already built that relationship. And I know that she could talk about my character as a person in addition to, my strengths as a learner too.